Now, one of the biggest expenses for state health departments is the money paid out in malpractice claims against various state hospitals and clinics. But a case in the Eastern Cape could change that, and potentially for other provinces as well. To explain this now, I'm joined by Dr. Rolene Wagner, head of the Eastern Cape Health Department. Doc, thanks so much for joining us. So I wonder if you could just break it down for us. Talk me through this very specific medical negligence case. What was it all about, and what came out of it?
Thank you. So thank you for having me on the show and giving us an opportunity to engage with you on this. So this particular case is a case of a young boy with cerebral palsy. He's 11 years of age, and there had been claims against our department for an amount of around 34.5 million rand when we went to trial. And the law up until this time, common law in our province, only allowed us to make reparation in what is called a once and for all payment. So in other words, you make the payment as an upfront lump sum settlement for this entire amount of 34.5 million rand. Following this judgment, it is now common law that is not the only way in which to make reparation. The court now allows us to make payments, either provide the services or provide the products that the child needs for the duration of the child's life, and also allows what is called an undertaking to pay. So an undertaking to pay is when we agree to pay for the services, either pay for the services up front or reimburse the client for services that we are not able to provide at any point in time. So that has a huge impact for us because the lump sum portion now is significantly reduced. So and that means that all other cases...
Sorry to interrupt. What is the lump sum proportion? So it would have been 34.5 million. What is the lump sum portion now?
Well, we'd already paid general damages, which normally amounts to around 2 to 2.1 million rand. In this particular case, the lump sum amount was set at 2.1 million rand. And it covers items like a vehicle so that the family can transport the child to and from services. It allows any adaptations to his home that is required. And it also allows for future earnings, what's called loss of earnings. So it provides for that for the duration of the anticipated life of the child.
So what, you mentioned that this once and for all payment, it doesn't have to be the standard anymore. So you offer a smaller lump sum, but then you offer services or products on an ongoing basis to help let's say that child to live their life more comfortably. Where would they get those services?
Right. So in this particular case, and not just for this, because as the Eastern Cape Department of Health, we've been preparing for the eventuality that all of our cases can be treated in this way. And so in this instance, there is a range of medical services that we've agreed to may be required by a child with cerebral palsy. It can range from the services of a neurologist, a neurosurgeon, a general surgeon, a pediatrician, etc. And then, of course, there's the rehabilitation care. And so rehabilitative services is the whole range of occupational therapy, physiotherapy, etc. And so we've given to the courts, as part of the order, there was a list of services that we agreed to would be required, and we then indicated that we can provide those services at the Freya Hospital and Cecilia Makiwane hospitals. We also then identified rehabilitation centres. So in our province at the moment, we have a total of 43 cerebral palsy clinics distributed across the province. These are in a network, and they refer in to our regional and tertiary hospitals. And so we are developing this network of what is called rehabilitation centres of excellence. This is your I suppose you could call it super specialist ways of providing rehabilitative care. We are not just focusing on the 3 that we're currently developing, as well as the 8 that we will have in total for the district, but we're also developing the skills of all of our therapists across the entire platform so that all children benefit from the knowledge and skills of rehabilitation in our province.
So my understanding then is that you're developing sort of specialised care to deal with, for example, which is a lot of the cases, children who end up with cerebral palsy from a badly handled birth in a state hospital. So that sounds good down the line. It's in the works. But how do you deal with the concern that a family might have that a child would be essentially having to go back to a hospital that falls under the state that has already let them down.
Yes, that is something that I have had as a concern. And in fact, that was what we had to prove to the court. Many of these cases come from as far back as 2004, 2014, 2015. And at that time, litigation was not a significant problem for the state. And so we are dependent on our records to defend ourselves in the courts. And often those records, if we can find those records, the records, the doctors and nurses typically indicate what they do find, a positive finding. And if there's a negative finding, no one thought to write from the perspective of that we're going to be litigated. So that's one of the challenges in defending ourselves. But nonetheless, where we've accepted liability for those cases, we recognized that there needs to be an improvement in the quality of care. And so whilst the children may have had injuries at birth, we have really, as a department, invested in our staff, in our equipment. Just in this year alone, we've invested 67 million rand for equipment for rehabilitation services in our province. We've not only focused there, but we've also focused on machinery and equipment for other conditions that prevents and promotes safer births for mothers and children. I think what we tend to forget is that specialists in the public and private sector were all trained in the public sector. We have in the public sector some really skilled health professionals who know their work and really are committed and dedicated to provide the best care possible. A lot of our specialists and our clinical teams do RWAPs. They do work within the private sector and vice versa. There's a lot of sharing of skills. And the one advantage we have as the public sector is that we're the only employer. And for rehabilitation care, particularly for children with cerebral palsy, it's an advantage to have a multidisciplinary team in these clinics. So when a child comes, he or she doesn't come to see just an OT or just a physio. They actually come together and we have these multidisciplinary teams that work together at a clinic. And so the child's getting the best possible care within our sector.
Okay. So you've explained how it could actually provide ongoing care for that child, which could be a good thing. The plan sounds like it's in place, and it also sounds like there could be a legal fallback if you're reneging in any way as the state on that child's care. I would imagine that this is incredibly good news for the state's constrained health budgets, because it allows you to stop paying out so much money in medico-legal claims and invest some of that money in creating the infrastructure needed not only to look after those who suffered at the hands of state hospitals, but also generally improve services. So it makes a lot of sense on many levels. Talk to me about the kind of savings. How much, first of all, tell me how much your department in the Eastern Cape has had to pay out in medico-legal costs, and what sort of saving are you hoping to see through this process?
So unfortunately, we have paid thus far, since we started having to make these lump sum payments, we've unfortunately paid out around 3.5 billion rand for medico-legal settlements. And that's a significant amount. Not only have we had to make these payments...
Sorry to interrupt. What sort of time frame are we talking for that 3.5 billion?
That was from around 2013-14 when we started seeing the claims. Around then it was 75 million. Then it quickly escalated to 200 million. In the 2020-2021 financial year, we paid out 921 million rand in 1 year. And we were looking that if this pattern continued, we would have paid out at least another 2 billion rand in the last 2 financial years. Now, pleading this case and having this as an option significantly reduces the claim, the lump sum portion. In this particular case of 34.5 million, we would likely have an 80 to 85% savings. Now, if we look at our contingent liabilities, that's the active numbers of cases that could possibly be brought to the court. So if all of those had to be heard tomorrow and we had to make the lump sum payment, we're possibly exposed to 30.5 billion rand. However, with this now being an option where we can provide medical care and with the undertaking to pay for certain services that we may not provide, it significantly reduces that by between 80 to 85%. Our actuaries and our finance teams are busy working on that exact amount now. But we are anticipating that there's probably going to go from the 30.5, we could have between a 24, 25 billion rand reduction in that contingent liabilities, which obviously is a positive thing for our liquidity.
Very useful with the reality of constrained and decreasing health budgets. This is a bit of a precedent-setting case, I understand. Is this something that could have national implications across health departments nationally?
So it's common law in our province, which means it's now an option in our province. I'm told, and again, I'm not a legal expert, but I am told that if they were to appeal and they're given leave to appeal, they can either have it heard at the Supreme Court of Appeal. It's likely then that if it's heard at the Supreme Court of Appeal, then it would apply to the entire country. My understanding is that it applies to our province, but it can be quite persuasive and can be used by other provinces because we've now set precedent in our province.
All right. Well, thank you so much for explaining that all so clearly. I really appreciate it. Dr. Rolene Wagner, head of the Eastern Cape Health Department. Now, the Gauteng